Okay, well, we can go ahead and get started. Good morning to everyone. And I am calling the April 27th meeting to order. Yeah, we'll go ahead with the roll call.
Okay, and I am very sorry, everyone, if I mess your name up. So please, names are not my forte. So we got Betty Arnold, Jane Groff. She make it on? I don't know if she's here. I haven't heard her. Diane Gerstend.
Gail, this is
Yes.
Jane. I'm here.
Hey, Jane. Glad you can make it.
You bet. Somewhere between Garden City and Great Bend.
Oh, man. Way out there.
Yeah.
All right. Did Diane Gerstand, Jessica Lane, Dr. John McKinney,
Present.
Gary Henholt,
Present.
Holly Yeager,
Present.
Jose Cornejo.
Present.
There we go. Okay. I knew I was going to mess that one up. I'm so sorry. Judy Rodman. Casey Dalek.
Casey Dalkey, I'm present.
Dalkey. Sorry.
That's okay.
Kathy Ko. Kimberly O'Connor. Sherry Blanchett. Leah Hawley.
Leah said she's not going to be able to attend.
Okay. Sue Murnane.
It's Murnane, but yes, I'm here.
Sorry.
Hey, you're good. Thank you.
Mark Torkelson. Melanie Martin. Misty Karnowski. Erica Mold.
I'm here.
Pam Wiegand. Rachel Soden.
It's Rochelle. I'm
Oh,
present.
sorry.
No worries.
Shelby Birkenhoff. Kimber Casctus. Janie Humphreys.
Present.
Oh, goodness. Marcy Wiseman.
Marcia Weisman here.
Sorry. Samantha Brown.
I'm here. Did you get that?
I did, yes. I don't know somebody's just joining. Sherry Dumlin. Idalyn Sherman. Tamara Huff.
Good morning.
Good morning. Melanie Scott.
Good morning from Dodge City.
Good morning. I don't think Jamie Dover. I don't think he's here. Tracy Chauvin.
Chauvin. Yep.
Okay.
Tracy Chauvin's here.
Chauvin. Okay. Scott Engelmeyer. Shirley Scott.
Here.
John Epley, John Dole, okay, Bert Moore, Cheryl Johnson, Kayla Love.
Present.
It's like, I know you're here, Kayla. Kent Reed, Carrie Haig,
Good morning, everyone. And I know Bert's in another meeting, so he'll be joining us
late.
late.
Okay, I think
And then,
Kent will.
Yeah,
Kent.
and Kathy KO just joined us too.
Okay. Maureen Tabasco. Got it.
I'm here.
Okay. Trish Backman,
I'm here.
Alicia Nichols. I don't think she's here. Angie Berngart. And me. Okay. That is everybody.
You got
Okay,
Angie, right? She was here earlier.
Is she here? Okay.
Yeah, she was here earlier.
Okay. Got her.
Whether or not she's still here now, but there she is. I see her.
Okay. All
Yeah,
right, I
this-
got her. So it
at
looks
this-
like we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 voting members here. And I don't know if Jane and Betty can vote. They're not included in that 16. So
Okay,
Yeah, they should be.
the next item then was to approve the agenda and
the minutes.
the minutes. But if we don't have a quorum, do we go ahead and bypass that?
If you want to do it, we can. If not, then we can bypass it. I'll leave that up to you.
I believe in Robert's Rules of Order, we would ask if there were any questions or any notes that anybody saw, and then we would make note of that, but then we would go ahead and move on, because if without quorum, we can't vote.
Okay.
Okay, well, thank you, Trish, for that. So questions, changes, anything that we should note before we move on?
Okay.
All right. Then before we go to public comment, I didn't take the opportunity to explain to the group I am co-chairing this with Jane, the mighty Miss Jane, and who is traveling. So Jane, be careful out there. We are going to now close the public comment section since we have no one. And we'll turn it over to Trish to give us an update on the open seats for the council. And Trish, yeah, there you go.
Yep, I had to unmute. Good morning, everybody. We do have 6 open seats right now on our council. And so one of the things I have done is sent a letter to Dr. Nineswander to see if he could identify a couple people from the House Minority Member or the Governor's Behavioral Health Planning Council, the Children's Subcommittee. So he is going to reach out to people in both of those venues. And then I also reached out to John Calvert, who you guys are going to have the pleasure of hearing from later today, because he is our school safety person at KSDE, and he knows a lot of people in the field who are very aware and up to date with legislation. So he's going to reach out to school resource officers and school security for those seats. So we have the other options with foster care agency representative, an associate from a nonprofit, private, or child welfare agency, superintendent, principal, or other secondary school administrator, and then an inpatient provider. So maybe somebody from a PRTF, a QRT, YRC, or an acute care facility. So if you guys know of anybody who would be a qualified or somebody that you think would be a very good advocate or a voice on this committee, please reach out to them. I've drafted a letter that I can send to you that you could send to them. We can send it via email. It has a hyperlink in it for the application that they need to submit. We would really like to have all of these positions filled as soon as possible. But as you know, because you've been through this process sitting here, that they have to go through an approval. So as soon as we can get people submitting their applications, it would be great. Starting a new year with every seat filled so that we have quorum when we need to vote, and we have minds that come from all different perspectives sitting at the table. I think including diversity and making sure that we're being totally inclusive is very important in looking at our membership. So I just want to reach out to you guys and help us fill these seats if at all possible.
Trish, thank you for that. I do want to mention that it is really important that we keep our updated profile so that the public knows, you know, this is nothing that's gone by the wayside. So as we, I'm sorry, I'm looking at the agenda here. As we move forward with this, Gail, I will ask you, we talked about updating membership, those that are currently on the council, as far as the new people that are on the council, and getting this updated on our website. Can you bring us up to date on that discussion a little bit? Do you remember?
So, yeah, so a lot of people's memberships ends June 30th. So I did send out a membership renewal. Somebody did point out to me that it says it's for last year. Indeed, that was overread on my site. I didn't get that part of it updated. It is in fact for the 23-24 year. I got some of them back, but I haven't got everybody. So I was going to fix that mistake in it and resend it out to the ones that end June 30th and see if they respond to it.
Hey, Gail, you probably sent that for KSPHQ to Monica, and she's on maternity leave. Would you mind sending that to me?
Yep, I will.
Thank you so
And
much.
I don't think your term is up. That's probably why you didn't get it. Because I have you guys sharing a seat.
Yeah. Okay.
Yeah,
Just wanted to check about that.
Yep. Yeah. So, and she did say that you were going to take over for her.
Yeah. As long as correspondence goes through me while she,
Yep.
instead of her, that would be great. Thank you.
Yeah. Yep. You're welcome.
So to piggyback on that, do you want to talk to them about the 1-year extension that the membership leadership team has discussed?
Yeah, so filling out that survey will give you a 1-year extension. So if you fill out that survey and you get back to me and say you would like to extend your membership for a year, it will extend you until June 30th of 2024. If you don't get back to me, your membership will end this year, June 30th, and your seat will become open on the application for somebody to fill that seat. So please get those surveys back out to me. I will send them out again today to the ones of you that have not responded to me. And if you don't want to extend your leave or your term for that year, that's fine. Just let me know, and I will mark it down and get your seat on the application so somebody can fill it hopefully by July. We will, after this meeting, we will set up another meeting with Betty and Jane and Carrie and Bert and Trish and go over the applications that we do have for the open seats. We will probably do that some before July, definitely, and notify those new members so they can join us in July. So the sooner they get those applications in, the better.
And I did get a letter request from Gary via email, and Tracy, I do see your message in the chat. So I will get those letters to you, just the drafts, so that we can get those out. Or if you want to send me the names and the contact, I can email it to them directly.
And Trish, the contact I sent you, I think we can send it directly to Cheryl. She's over for the next few months over the PRTF stakeholders group, and we can get it on the agenda. She can probably send it out ahead of time. We might get someone before the June meeting.
And Gary, I know you and I both sit on that group. It's Cheryl who?
Rathbun.
Okay, thank you.
I sent you, did I send you I thought I sent you the Outlook contact. If I didn't, I'll do that.
I'm working from one screen at home
Okay.
today, so I'm going to tell you that I didn't think I would ever need 3 screens, and now I am so spoiled. I'm having my computer with a different mouse and my phone, so I'm multitasking. I saw your email, but I did not read it because I wanted to give
I'll
you
look and
attention.
see. I'll look at my sent email and make sure it's there. If not, I'll send.
Okay.
Yeah, I have
Thank
3
you.
screens. I don't know how I could do it without it anymore.
Well, we get spoiled pretty quickly, don't we?
Yes, we do.
All right, thank you.
And Trish, thank you. Gail, thank you for that. We are running a little early, so I'll take the opportunity to just throw in one of the things that's number one on my list. When we look at the purpose of the Mental Health Advisory Council, the first thing, advise the Kansas State Board of Education of unmet needs. And I am hoping that as we go through our meeting, we can be more intentional about what kinds of recommendations that can be made with the change in leadership. I think it's been a while since the state board has had a presentation, so it's up to the council to be aware of what those unmet needs are. And actually, I should say those that perhaps we haven't addressed. So as we move forward, please just kind of start to think about that. Because right now, and I am hearing from a number of parents, it's good that we have John as our next speaker. I'm hearing from a lot of parents that the violence and bullying is increasing. And that's just from a state board perspective. So as we go through this, please, council members, bear in mind what kinds of things we can recommend or suggest to the Board of Education in terms of those unmet needs. Is John available to start early, or? John, are you there?
Yes, ma'am. I am here and can start when I get the ability to share my screen.
Okay.
Get that available for you. All right.
Oh, somebody else is sharing, it says.
Yeah, I'm sharing. I just can't figure out how to stop. There we go. You should be able to share now.
Well, good afternoon, or I guess good morning still. Good morning, everybody. I hope we're having a great day. I just pulled into Wichita. I'm speaking to a whole bunch of school resource officers here in a little bit. We're setting up the Kansas Juvenile Officers Association conference that's coming to Wichita here in a couple of months. So very excited to talk with them about that. Excited to talk to you guys about what we're doing in the Safe and Secure Schools unit here at the Kansas State Department of Education. I'm going to try and go through as much as I can in a short amount of time, because I know I want to leave as much time as possible for questions and any concerns that you guys may have. But first, if you don't know me, I graduated from Washburn University in 2006. I am a huge band nerd. I played trombone, baritone, tuba, and drums. Some people have spirit animals. I have spirit instruments, and the tuba is my spirit instrument. Loud, obnoxious, boisterous. That's me. And those of you who know me know that that is true. I went straight into law enforcement, had a full-time 12-year career in law enforcement. I'm currently part-time certified, but the last 6 years, I was a school resource officer. And I like to point out to people that in 2018, I was carrying around massive bottles of hand sanitizer before it was cool, before the pandemic. And yes, I get the question a lot. I still have my Wonder Woman backpack. I do. That's where I get my superpowers from. But was a school resource officer up in Jackson County, Kansas for Royal Valley, Holton, Jackson Heights school districts. Loved my time there. For the last 4.5 years, though, I have worked for the Kansas State Department of Education in their school safety unit, and I'm currently the director of that unit. The last photo is the most important to me. That's my family. That's my why. My wife is an elementary school principal here in the state of Kansas. I have 2 beautiful babies who luckily take after their mother. My daughter just turned 12 years old. She's in 6th grade, and my boy is going to turn 9 next month, and he's in 3rd grade. And so when I talk about school safety, I do so because it truly is a passion of mine, but I also do it because I'm selfish. When my wife goes to work, I want her to be safe. When my kids go to school, I want them to be safe. So I can wear a lot of different hats, which is good because I am bald. And so anytime I can wear a hat is a good time. The question that I ask most often is, what are we most afraid of? If I were to ask you, what are you more afraid of, coconuts or sharks? What are you more afraid of? And overwhelmingly, we're going to be afraid of sharks, right? Could you imagine a 3-part movie series on coconuts? Donna, 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 Donna. Nope, it's still there on the tree. Whew, okay. Or we have Shark Week, right? Could you imagine Coconut Week? What in the world are we going to talk about coconuts for an entire week? But statistically, you are 15 times more likely to be killed by a falling coconut than by a shark. Okay, so there you go. There's your useless Jeopardy knowledge of the day. You have learned something when you go home and you're talking to your spouse or your kids or your friends and say, what did you learn today? This is what you've learned. And I know what you're thinking. Well, John, I don't understand how this ties anything to do with school safety. You have just gone way off the rails and you're following a squirrel. But why is it that right now in April and May, this is the meme, this is the photo that I see pop up on social media most often? When you finally graduate a school in the United States, we're no longer tossing our caps, right? We're tossing bulletproof vests because that's what we hear about all the time. But statistically speaking, again, here are the numbers. We lose on average 49 kids a year due to violent events inside of the school. That is a horrible number. Please do not think that I'm out here saying that's great. We are working very, very diligently and hard, not only here in the state of Kansas, but nationally to get that number to 0. I like to tell people my goal in life is to have Dr. Watson come down from the 6th floor, find my cube on the 3rd floor, come in and say, John, you're fired. And I go, Dr. Watson, why am I fired? I can't believe it. And he says, you've done such a great job. We no longer need school safety. Done such a great job. We no longer need you to be here because schools are 100% safe. I think that would be great. I'd love to walk into my next job interview and they said, man, you had a job with the state of Kansas Department of Education. Why did you leave? I was too good at my job. I think that would be fantastic. What a great interview question. But we lose 522 kids a year statistically in restaurants and bars due to violent events. I've never done a lockdown drill at a Buffalo Wild Wings. I've never gone into a Chili's and asked to see their crisis plan. What I try and tell educators especially is that we are 1,600 times safer inside of a school than we are anywhere else. This thought of school violence is a community problem, is an issue that gets brought into the schools. Now, I've talked to superintendents, I've talked to staff and teachers and kids who have actually lived through these school shootings. I would never disrespect them. And I'm not trying to try and play this off at all, that it's not going to happen, because it will happen again here in Kansas. It happened 2 years ago in Kansas. It will happen again, right? But the sky is not necessarily falling right now. We are safe inside of our schools. But the movie that I go back to over and over again, and I look out into Zoom universe here, and I see I'm probably the oldest one on the Zoom right now. So I'll set the stage for you. Back in 1994, 95, Jim Carrey came out with his first real big movie. It was called Dumb and Dumber. For those of you who haven't seen it, he goes cross country to deliver this briefcase to the lead female role, and he's talking to the lead female role afterwards, and he says, so what are the chances that you and I go on a date? And she says, well, I'm engaged to be married. And he says, okay, great, well, what are the chances? And she goes, I don't know, 1 in a million. And his response is, so you're telling me there's a chance? There is absolutely a chance. And it's something that we have to be prepared for every single day. And we have to continue to go above and beyond. But it's not just a certain person. It's not just a group of individuals who have to worry about safety. It is every single person, every single day. It is a group effort when we talk about school safety. House Bill 2567 this last year, not this year, last year, provided $4 million in state funds and $1 million in federal funds, so $5 million total for our Safe and Supportive Schools grant. And that grant was able to be covered by security cameras, by infrastructure, and hiring first-year SROs. Not second-year SROs, not, oh, we have one, now we want to use the grant, but first-time SRO positions. And it was a dollar-for-dollar match, meaning that if I, as a school district, applied and received $200,000, we had to match that with $200,000. So really, realistically, that helped us get about $10 million in school safety funds. We had 156 districts apply, and we had just about $12 million requested. So we went to a per pupil basis, and for each pupil, we assigned a dollar amount, and that is how we distributed those funds across the state of Kansas. Very, very short turnaround. The governor signed this bill May 6th, and it had to be returned to us June 10th so that we could figure it all out, get it in front of the State Board of Education for their approval, and then distribute the funds in July. That was our goal, and we've done that, and we've seen some amazing things go on around the state. This was the 4th year that we've had the $5 million. And as it is right now, again, you never know 100% until it's signed, but the language is putting back another $5 million for us for this school grant. And it will again cover the infrastructure, the security cameras. They've opened it up to communications so we can upgrade our intercoms, our phones, two-way radios, or our radios with our law enforcement so we can help communication that way. And then they've actually added as well the naloxone or Narcan. That can actually be purchased at any time, not even purchased. You can get naloxone, Narcan at any time by going to KDADS, and they will give you your order for free. And so we will be communicating that and have communicated that with our schools, that if you need that naloxone, and if you don't know what Narcan naloxone is, it's the drug where if you overdose, they give that to you and you kind of come out of that overdose. And so we know that there are districts out there who have trained all of their staff. There are districts out there that have trained their nurses and have it on hand. And so that, again, as the language is written right now, that is what it can be used for. We are still waiting for the go-ahead and to see what the governor does sign. We have 22 recognizable hazards here in the state of Kansas. One of those is the major disease outbreak. I think we failed with that one. 2020 and 2021 kind of showed us that we needed to beef that up a little bit. But when we talk about school safety, we don't just focus on the active assailants. We focus on lightning strikes. We had a district 2 years ago, the first day of school, had an earthquake, and it rendered their district office unusable, uninhabitable, and they had to evacuate and remove all the students from their high school the first day of school. Not the second day, not, oh, down the line, the very first day. We averaged 2 to 3 earthquakes every day here in the state of Kansas. And so, again, extreme temperatures. What happens if we have droughts or wildfires, windstorms, those kind of things? We're not solely focused on active assailants. We talk about all 22 hazards. And we believe that when you create your crisis plan, it should identify what hazards are in your area and what you should be ready for and have a plan for. We have what I call the one-page grab and go. I think this is fantastic. I think it's fantastic because I created it, but it's awesome. I I'm a firm believer that superintendents should know their crisis plan. Administrators and principals, assistant principals should be able to reference their crisis plan and pull that out and go, okay, it's over here. This is what we need to do. Teachers and staff members probably aren't going to know the 70, 80-page crisis plan by heart. This is a great tool that we can use and give not only our educators, but our substitute teachers, put it in the sub-plan where you can highlight this and print it off in red or green or bright orange paper, laminate it, put Velcro on it, stick it by the door, put it in that sub-plan, and it gives just touches on 9 different things and gives you little bullet point things that you can kind of go through and go, oh man, what do I do? There's a medical emergency. Oh wait, I need to call 911. I need to make sure that I don't move the victim unless they're in immediate danger. We need to sit there and we need to focus on these kind of things. Oh, okay, got it. Yeah. Great for educators, great for our subs, especially who may not be trained up like our classified classroom staff. When we talk about school safety, it's not just about the hardware that we put in. I'm a firm believer it's more about the hardware. The number one thing we can do to keep our schools safe is to build and maintain positive relationships with our kids. The Secret Service, the federal government just put out a study that said 92 to 96% of the time, another student noticed a concerning behavior for each of the active assailant events. And at least one person, maybe not just a student, but at least one person noticed a concerning behavior in every single active assailant's life before the event occurred. We need to create a community and a family and love around these kids that when something's going on or they see something on social media, that they reach out and say, hey, Officer John, so-and-so posted this. Great, because I would rather investigate and stop a bajillion of these threats than not know about the one that is actually going to happen. We have to create a community and a sense of positive school climate and culture to where these kids who are on social media 24/7, who hear the leakage that these people are talking about, can say, hey, I'm worried about my friend. I'm worried about this kid who I saw post this or was talking about something like this. And it may not be active assailants. 1 in 13 of our kids will attempt suicide. Not think about, talk about, have a plan, post about it. 1 in 13 of our kids will actually physically attempt suicide. And so having that positive climate and culture and that hardware, we can then go out and stop these events before they're happening. And fortunately, unfortunately, we don't have a really good way of looking and tracking all of the events that we have stopped prior to them occurring. The other thing that I talk about hardware is it's great that we put the hardware in, the doorbell ring cameras, the cameras in the hallways, the locked doors, all of these things are fantastic, but we have to train on them. We have to give the appropriate staff the training. I can't tell you the number of times that I'll walk into a school and I'll press the buzzer and I just get buzzed in because I'm wearing a suit and a tie and I look real fancy and they go, oh, he's good. We've got to provide the training and say, listen, you have to ask these questions. You have to go through and say, hey, why are you here? What's your name? What's your purpose? Maybe they don't even need entry into the building. But without that training piece, all we've done is added a camera and a buzzer. I'm 100% totally for trauma-informed drills. The pushback that I get most often, the question that I get most often is, John, these active assailant lockdown drills are creating trauma for our kids. Totally understand, and I get it as a parent. This first picture is during the Cuban Missile Crisis. We've been doing drills in our schools for a long time. In 1995, 96, I was in 6th grade. I was in Mrs. Wells' science class in Ross and Robinson Middle School in Tennessee. And over the intercom, they said, Mr. Robinson, please come to the courtyard. We didn't have a Mr. Robinson and we didn't have a courtyard. That was the lockdown call. And so it was turn off the lights and we actually got underneath our desk. And I remember at that point at 12 years old, I probably should have known that I was going to be something in school safety because I remember saying, Mrs. Wells, I don't understand. I'm sitting here in front of the door. I can see out into the hallway and I'm hiding under my desk. If I can see out into the hallway, can't they see me? And Mrs. Wells said, because I was that kid. Said, John, stop talking. I said, oh, okay. Love you too, Miss Wells. Those drills and those type of things have morphed into these full-scale exercises, which if you've never been a part of the planning piece and watching these full-scale exercises that are done in our schools and in our communities, it's not just our schools, but our communities, they're fantastic. They're a lot of fun to watch, especially in our schools when they get the drama club and the kids who love to get made up and act. Our kids do fantastic work. It's incredible. My heart goes out. I'm like, oh my gosh. But when I'm on these planning committees, the thing that I tell the schools is the planning piece is invaluable for our schools. Our schools will learn so much just by sitting around a table with all of these partners and going through how this is going to look and what the plan really is. It's fantastic for them. The drill and exercise itself, the school doesn't normally get a whole lot out of it because they've already got everything from this planning piece. One thing that I will, when I talk through the planning and that I won't waver on, is that when our kids get made up and they're in the drama and they're doing all these things, they will never die. They don't get to play dead. They don't get to say, oh, I'm dead. This normally upsets the first responders, the fire, the EMS. Well, how are we supposed to put a mannequin out there, put a note on them? Our kids will never, ever, and should never, ever play dead. Because what I don't want, and I had the absolute privilege of watching and attending a conference where the first responding officer to a Sikh temple shooting a few years back got there, was shot like 12, 13, 14 times. Says I was shot in the neck, the face, the arms, the legs, the back, the chest, everywhere. He said, I get drug into a police car, into the back of a unit. They're peeling everything off. And everybody I came into contact with said, you're going to be fine. You're good. Don't worry about it. You're going to be okay. They put him in the back of the ambulance and the EMTs are working on him and saying, dude, you're good. You're going to be fine. We got you. Everything's okay. He gets taken to the hospital and he says, I start getting really tired and I kind of just want to take a nap. And I'm hoping that by taking a nap, this pain that I'm constantly feeling maybe goes away a little bit. And he says, so I start drifting off and the doctor slapped me across the face. And he said, you got grazed by a bullet. You're going to be fine. Quit it. And he starts chuckling and he says, if I got grazed by one bullet and this is how I feel, that's kind of crazy. But he said, everybody I came into contact with said I was going to be fine. And so I truly, honestly believed that I was going to be fine. And we do studies on law enforcement officers and people who get shot in non-life threatening parts of their body, their big toe, their thigh, wherever it may be. And you hear them on their body camera, on their dash cam say, oh my gosh, I'm shot. I'm going to die. And they die. So I've already told you that we're 1,600 times safer inside of our schools than we are outside of our schools. What I don't want is for one of our drama kids to play dead during these exercises. And then something happens out in the real world, whether it be at a movie theater or Walmart or restaurant, wherever they're at. And then they get shot or something happens and they go, oh, I've been here before. We were doing this. I'm going to die, and have their mind already go there. When we are part of those, we provide the guidance and some considerations when we talk about these plannings. Our kids should get up and walk out or be helped out under their own power. They should never, ever die. This last two photos here, this is my boy. I never believed that when my mom said, if you continue to make a face, it's going to stick. I didn't think that was true until I had my boy. And this was the face that he made probably the first 2 years of his life. And I love this last one. My daughter's just so sweet. Like, don't worry, I'll just sit here and kiss him. You just take the photo. We're fine. But when we talk about trauma in drills, my son was about 2 years old or so when he entered into a year-round daycare. And that daycare, because it was year-round, had to do fire drills every single month. So drop him off, I go pick him up from daycare. And there was a note in his box that said, we had to carry your son outside today. And I went, that's weird. He can walk. What's up? And so I talked to the director of the daycare, and she said, we had our first fire drill with John today. That's my son's name. That's not just a name that I throw out there. It's easy for me to remember. But she said, we had our fire drill with John, and he didn't like the noise and the flashing lights and fell to the floor. And we tried to coax him. We tried to talk to him. all of his friends lined up and started walking outside. And so we had to actually pick John up and carry him outside. Once we got outside, he was absolutely fine. I said, okay. So the next month I get another note in his box, says, hey, we had to carry him outside for the fire drill. So I started talking to the director and I said, why don't you just give me a heads up the next time you guys are going to do a fire drill, and I'll talk to him that morning. Okay. So I take him home and I said, hey, buddy, fire drills, what's up? And he starts crying. And in true like 2-year-old form, he goes, owie, dada, owie. Yeah. I bet it is pretty loud. I said, but what happens when you go outside? He goes, oh, we go outside and then we play. I said, okay. So when there's a fire drill, why don't you cover your ears, get in line, walk outside, and when you get outside, you can play with your friends. Okay, Daddy. I said, hey, buddy, I need you to be a big boy. You can do it. I know you can do it. Be a big boy. And so the morning comes, I go to drop him off, and the teacher says, hey, just so you know, today's the day we're doing a fire drill. And so I got down on his level. I got down on my knee and I said, hey, buddy, today's the fire drill day. Remember what we're going to do? And he goes, I cover my ears. I be big boy, Dada. I be big boy. I'm like, oh. So in true dad form all day long, I'm sitting there and I'm wondering and I'm waiting and I'm hoping that he does all right in this fire drill. I get to the daycare and there's no note in his box. Yes. And I go talk to the teacher and she said there were some tears, but he covered his ears and he walked outside. Yes. I take that. Right. And I said, okay, we are in charge as the Safe and Secure Schools unit. We can provide guidance to how we do lockdown drills. I'm a huge proponent of telling everyone, hey, next week we're doing a lockdown drill. Tomorrow, don't forget we're doing a lockdown drill. You don't have to give out specific times, but tomorrow we're doing a lockdown drill. Put it out to the community. Hey, parents, guardians, loved ones, we want to let you know we're going to do a lockdown drill tomorrow. Hey, everybody, in about 30 minutes, we're going to do a lockdown drill, right? We don't want to create trauma. Give them a heads up. Tell them it's coming. It'll be fine. My boy in kindergarten, my kids know what I do. So my boy comes home from kindergarten and says, Daddy, we did a fire drill today at school. And I said, oh my goodness, you did a fire drill at school? How did it go? He goes, it's just like daycare. We lined up and then we went outside and we played. And I'm like, that's my dude. Great job. And he says, Dad, I know what to do if there's a fire in the house. Dad of the year here had never had that conversation with my kids about what to do if there was a fire in the house. I said, what do you do? He said, I go out into the hallway, I go out the front door and I go across the street and I'll wait for you, mommy and sister across the street. And I said, you're not going to wait for me first? He goes, no, I just go out the door. I said, what happens if you can't get into the hallway? And he says, oh, Dad, I'll just go out my window. Oh, bet, prove it. As true 5-year-old form, goes into his room, pulls over his little bookcase, stands on it, and opens his window. And I went, oh my gosh, the kid can open his window. Okay, I can't put a lock on it, but maybe I put an alarm on that thing. I'm going to put a bell. But what I try and talk to people about were the first couple of fire drills traumatic for my son? Was there trauma involved in those fire drills? Absolutely. He was a puddle on the floor. But with the right kind of coaching and preparation, the life-saving tools that he learned can be rolled over into everyday life. The same if we address those the active assailant lockdown drills, it's the same thing. I feel like we don't know as adults, we don't know a world where we're doing lockdown drills. I did one K through 12, and Columbine happened my freshman year of high school. Still never did a lockdown drill afterwards. I did one. My son and my daughter don't know a world without doing lockdown drills, just like we didn't know a world without doing fire drills. And while that's sad and it's gut-wrenching, and I hope that and pray that one day we don't have to do these anymore, we have to make sure that we as adults aren't passing our trauma of teaching it on to the kids. Because again, we're 1,600 times safer inside of a school. And as educators, if you teach math or you teach science or social studies, my hope is that if I were to teach math, the kids use math when they leave the school. It's not just confined to the school building. They use it outside. Statistically, that's the same thing that's going to happen here. They're statistically more likely to use these kind of skills in lockdown drills outside of our schools than they are inside of our schools. This is an actual photo, February 12th of 2020. I am in a training, getting trained, and my wife calls me. That's weird. She doesn't call me. She knows I'm in training. So I text her, can't talk. She calls me again. Okay, I probably should pick this one up. So I pick it up. She said, hey, want to let you know, got a call from the school. Our kids were involved in a bus accident. And I went, oh boy. Okay. And so I said, okay, what do we need to do? As the school safety guy, I say, ha, 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 don't go to the school. When there's an event, don't go to the school. As a dad, where was I going? I was leaving and I was going to the school to make sure my kids were okay. Luckily, my Facebook alerted me that there was a reporter who was live on the scene. I was able to watch my kids via Facebook Live, walk off the bus, walk over, get checked out, and actually get on a new bus. The way you know that I can't make this up is that the bus was actually stopped, picking up the last kid of the day. The silver car crests the hill, comes over top, tries to stop, can't stop, slides on the slick roads, and hits the bus head on. Who was the driver of the silver car? The bus driver's mom. Can't make it up. Couldn't make that up if I tried. My kids come home that day, they ride the bus, they get off the bus, they come inside and they go, Dad, our bus got into an accident. I said, oh my goodness, it did. Let's talk about it. We talked about it, everything was fine. For the sake of time, the next 2 days in the morning, I go to get my kids on the bus and they say, oh, Daddy, my tummy hurts. Whoa, okay, do you need to go to the bathroom? Are you going to be sick? What's going on? I don't understand. Well, it was because there was trauma. They didn't want to get on the bus. And I said, I don't understand. What do you mean you don't want to get on the bus? You get on the bus in the afternoon and it's just fine. Well, the bus doesn't get in accidents in the afternoon. They just get in accidents in the morning. There was trauma caused by this accident that even I didn't understand until day 2 or 3 afterwards. And so we had to work through that. They get on the bus now and it's just fine. But if we're worried about trauma and we don't want to do these drills because of trauma, we average in the state of Kansas over 200 bus accidents a year. That created trauma. So we need to get rid of buses and we need to get rid of fire drills. Nobody's talking like that. And I don't think we should. What we need to be doing is we need to start working through that trauma with our kids and providing them an area and a space and a person that they can go to and talk to. That's how we can get through these kind of events. We talk about mental health all the time. I'm in charge of the mental health intervention team grant. We're in 66 school districts here in the state of Kansas right now. We're hopeful to get some expansion money there. It's back and forth between expanding and not expanding. But this is our own Kansas Communities That Care data for the state of Kansas pre-pandemic. And so again, it's the second leading cause of death. Suicide is the second leading cause of death of our kids. Statistically, 1 in 13 are going to attempt suicide. Not think about, talk about, have a plan, physically actually attempt. And so when I look at this KCTC data that shows that almost 500 15-year-olds admitted to attempting suicide in the previous year, that's gut-wrenching. It harms me mentally to think that that's what our kids are going through. My daughter just turned 12. And so when I look at the 11-year-olds, at almost 300 11-year-olds, what in the world are we doing and what is going on that is causing our 11-year-olds to feel like suicide is the only option? What is the mental health intervention team grant? Basically what it is it provides a liaison. And I'm going to tell you, our liaisons are second to none. They are amazing, amazing people, amazing individuals with the biggest hearts. I'm so blessed that I get to interact with them and hear their stories and provide guidance and just listen and soak up all of the things that they're doing. They play the center fielder, if you will, if you're a sports person. They kind of are the leader. They're the captain. And they work with our community mental health centers, our private providers right now, our schools, our parents, to navigate that mental health system. What it does is it knocks down barriers that we have intentionally put up when it comes to getting kids mental health for our schools. Parents who have to take a half day off work, kids who are taking a half day out of school, gas money, travel time, all of the things that we've put up unintentionally for our kids to get these services. This brings a therapist, a case manager into the school. They work with the liaison so the kid's not missing the same class over and over and over again. But they come in, they get their therapy, they get their case management right there into the school, and then they go right back to class. It is absolutely fantastic. They're working, our liaisons work close with the foster contractors and our kids who are in the foster care system, because we know that that is such a marginalized group that we need to make sure that we help them every single bit of the way that we can, and help, again, these adults, whether they be guardians or parents or foster parents, who may not understand and know the mental health system. These liaisons go above and beyond and just do fantastic, fantastic things. This actually started in 2018-19 school year. We had 9 districts who applied and were chosen out of those. And we funded 45 liaisons, 212 foster students were served, and 1,708 students were served total throughout that year. It was fantastic. This year, in the 22-23 school year, we have 67 districts. We have about 150 liaisons. And as of July 1 to December 20, 2022, so this was when our progress report was due, we have served 4,801 students. Of those, 447 of them were foster students or students in foster care system. That's amazing. My heart goes out to all of them. Again, our liaisons are second to none, and they do fantastic, fantastic stuff. What we try and do as well when we talk about our MHIT program is we focus a lot on our success stories, because it's one thing to go out and provide these services. It's another thing to see, oh, wait, this is actually working. One of the things, being in the 5th year, I love this first success story. Our teachers and staff have become so familiar and comfortable with referring these kids, because now we have eyes on kids, that they're focusing on all kids, on every individual child. We are out there from the quietest kid to the loudest kid, whatever it may be. We're understanding that mental health and the help sometimes looks a little different depending on the kiddo. The last one there, many of our students were not getting therapy because families struggled talking to them for whatever reason. They're guaranteed the help that they need because they get it at school now. The barriers of, I can't take off work. The barriers of, I don't have the gas money to drive 45 minutes one way. We're able to break those down and get them the help that they're needing. This one is the one that I will hold on to forever and always. High school student was talking to their liaison and said, my therapist saved my life. There's not a better reason. There's not a dollar amount that can go out and say, you know what, with 4,800 kids, if we just saved 2% of them, how many kiddos is that, right? If we saved 10%, if 10% of those kids were having suicidal ideations, that's 480 kids. What dollar amount do we put on that to save 480 kids' life? It's fantastic. Again, so blessed to be a part of these liaisons and this program, and going forward and trying to help every way that we can. It's a fantastic program. This is my contact information. If there are any questions, this was my last ever yearbook photo as an SRO. They hashtagged it "Twinning is Winning." The pig's name, in case you want to know, is Chris P. Bacon. I thought that was funny. I think that's great stuff, and I'm all about it. I'm looking at the chat here. Melanie says debriefing afterwards. Absolutely. Whether it's a drill or a real life event or anything, getting the staff together, talking to the kiddos, debriefing with the kids, then getting the staff together and debriefing with the staff. What questions came from the kids that we couldn't answer? Get those questions answered right then and there. If the principal, the administrator can't answer it, they go to the superintendent. If they can't answer it, they come to me and we answer it. Because the last thing that we want, especially when we talk about relationship building, is the last thing that we want is for a kid to ask a question and we say, okay, yeah, I'll get the answer. And then we never do because we don't know. So that debriefing on every single level, so important. But I appreciate the time that you guys have given me. I've left it about 10, 15 minutes for questions, anything specific that I can go over. or kind of clear up. Again, appreciate what you guys do, and I'll pause for questions.
John, thank you so much for that presentation. But as I look at, and guys, I hope you don't mind, I'm going to start off with my question. And it's encouraging to hear of all of those things that we have in place, those safety measures, looking at the hazards. But one thing that pops in my mind, and perhaps you can elaborate on this, when we look at the suicide triggers, and I still hear a great deal from parents that their concern is bullying in school, and that is a major trigger to suicide attempts. So if you could maybe give us an update on where we are with the prioritizing of bullying in our buildings.
Absolutely. So bullying has been an issue that got brought to the forefront, especially during Columbine. I'm not an expert in bullying. I know we have that bullying task force, and there are people who are probably on this call that are much more well-versed in that than I am. My suggestion, and I have a presentation on it. I talked to kids yesterday about it. Change in our schools and our communities has to be student-led and student-created. I like to say, I don't want you to have buy-in, because if you have buy-in, you can sell out. I want you to have ownership, because when a kid says, hey, we don't do that here, that means something. Hey, if you're going to be my friends don't do that. That means something. I go in and I'll talk to kids and say, hey, listen, TikTok, #1 most dangerous app out there. #1 app used for child trafficking. Our governor in this state says that if I had a state issued cell phone, I could not have TikTok on that cell phone. But don't worry, 12, 13-year-old, you can have it. Yeah, that makes sense. Snapchat. There's nobody out there who can tell me what kind of photo we want to take that deletes itself in 10 seconds. But our kids need to understand that when we send those inappropriate pictures, those are felony level offenses. Just asking for an inappropriate photo is a felony level offense. And a felony is a crime that can be punished by a year or more in prison. You can also have to register as an offender until you're 25, 26. And then I'll pose them the question. The 39-year-old school safety guy just told you that you need to delete Snapchat or TikTok. Who's going to do it? There's one hand that'll go up because they feel sorry for me, right? I was in a district yesterday, had over 400 kiddos. I had one hand go up. Yes, I did it. I said, okay, hypothetically speaking, your best friend says, hey, we should delete TikTok because I don't like TikTok. I think maybe Snapchat. I think the streaks are stupid. We don't get anything from these streaks. I think we should just delete Snapchat. How many of you as kiddos are more likely to listen to your best friend than the school safety guy and delete the app? And it's funny because the kids will start looking around and then they'll see their friend raise their hand and they're like, oh yeah, absolutely. So when I take that information and I look at it, I say, okay, kids are more likely to listen to kids. We've got to get kids involved. And so often as adults and as people, we want to take and create stuff. We want to hang another poster. We want to have an assembly where the guy comes in like me, comes in and says, don't bully, don't be a bystander. Stick up for each other. And you feel really, really good about yourself for about 30 minutes. When we can have kids leading, and when I walk into a school and I see kids leading, I notice the climate and culture is very, very different in that building. And when I walk down the hall and I see kids saying, hey, we don't do that here. Or I look on social media and somebody will post something and a kid underneath it goes, hey, I'm worried about you. Let's talk. Or, hey, there's no room for that here. You need to delete this post. When kids lead the way and kids have the ownership, I think that's when we can really start seeing the climate and culture changing in our schools. And so we have to empower our kids to be the change.
Okay, any other questions for John from the group?
Hey, John, it's Maureen.
Hey, Maureen.
Hey,
It's my
John.
bestie.
How you doing, man?
Good.
So you mentioned your conference. that you're working on? So you're down there planning the conference. Are you going to push out when that conference is going to be?
Yes. So the conference is going to be in late July, early August, and we're finalizing everything right now. We're finalizing the agenda. Again, this is not something that KSDE is putting on. It's the Kansas Juvenile Officers Association, and that is for anybody who has anything to do with kids. We try really hard to try and get educators or juvenile justice individuals out here. It's not just for SROs or law enforcement. And when that does come, I will make sure that we push that out to all the listservs. But it's a fantastic conference and great time for networking.
So I'll just fill you in. There's a big KSDE conference in late July in Wichita. So hopefully they will not overlap because we can't all
That's the hard part about planning conferences.
Right.
It seems like there's always something going on, which is great.
Yeah. Thank you.
Hi, this is Monica Mernan.
Hi, Monica. How are you?
I'm doing great. I have I apologize. I came in towards the end of your presentation when you were specifically talking about MHIT. And so absolutely agree with everything you said. I totally think that, if we can do, one kid, it's a good thing, right? But I believe that as a state group that we are to advise and recommend to KSDE to the Board of Education. I think we always have to keep at the forefront that while that particular project has made significant impact, it is still only in 67 school districts, and we're 5 years in. I kind of have a unique perspective on this without getting into a lot of details, but I was there when it was passed. I still continue to have concerns about scalability. And I specifically have concerns with the simple fact that many of our school districts are in areas where their community mental health center does not have the capacity to participate. And so therefore they don't have an option. So as a group, I would like us to continually applaud the success, but keep in mind, this is not a statewide sustainable model because it is so dependent upon that relationship with the community mental health center. And so while the application does allow for partners to be involved, the model still is very driven on that community mental health center model. I understand that there's some talk across the street right now to make it again only available to community mental health centers. And I just feel like as a member of this group, I think we need to keep pushing positive things like this, but keep our eye on the fact that we need a statewide option. That's my soapbox. Thanks for letting me jump on it.
Oh, no problem. And to address a little bit of those concerns, because those are the concerns that we have as well. And we've worked with legislators and other community mental health personnel. And they've assured us that Kansas is moving towards not just the CMHC, but the CCBHC model.
Yes.
When that occurs, we're going to get more funding. We're going to get a lot more people and staff. And so that will help those rural areas, if you will. And then you're absolutely right, the sustainability with funding. And we've tried to put some guardrails and some parameters on the hiring and the funding for that as well to try and address those. But I don't care personally, I don't care where our kids get the mental health services. I don't care what we need to do. If they're getting help elsewhere, great, absolutely fantastic. But I absolutely share your concerns, Monica, and I want you to know that we're working towards fixing those as well.
So John, just to circle back to your beginning of your conversation about the connections and making sure that we're building positive and healthy, sustainable relationships with kiddos. When we look at 67 out of 286, Monica, that's 23% for those of us that are math nerds and like to do the numbers. Well, that, you had your tuba and I have my trumpet and I trumpet the data tells the story. And I see Tamara has her hand up, so we need to get to her, but we definitely think this is an unmet need. And Betty, I agree with you that we need to probably talk with the board about this and kind of have another meeting with our leadership to decide how we're going to address this and what kind of topics we need to bring up with the board. Tamara, did you want to talk?
Sure. I just want to make sure that we are, again, making sure families are included in this conversation. You know, as a mother and a grandmother, this information to me, I'm like, oh, we're not supposed to go to the school when something happens. And I think that, you know, if we make sure that our families also know what those plans are and how they can help situations, you know, knowing here's what the school is expecting in this situation, so that parents can enforce that or reinforce that at home as well would be great.
And hearing from our family gurus, it did prompt another thought. I got an email, and this is a huge problem. As school districts get larger, the question is always, who do I get in contact with for specific needs? Navigation should not be a problem, especially in this day and age. But I got an email from a parent of not knowing who I can get in contact with for follow-up on a specific problem. That's a concern for me. And I know that I still have issues. Okay, who do I talk to as far as this particular problem or that particular problem? And it gets to be pretty frustrating. So that might be something we could list in under unmet needs as well. How to navigate through the system. Anybody else? We still have a few minutes left for John.
All right. Well,
Okay.
thank you guys again
John,
for just
real
allowing me
quick.
to be here.
Real quick, if you could identify one area, I mean, you've done very well with covering all of the met needs. If you could identify an area that perhaps should be presented to major stakeholders, what would that be? What area would that be in?
I think the biggest area is that, again, safety is not a one person or one group thing. Safety, when we talk about school safety, it is everybody every day. As we've seen around the country, as an SRO, I could go around and check every single door every single time. But if one teacher puts a rock or doesn't make sure it latches and props the door open, that whole security thing that we've done now doesn't mean anything. From the custodian to the lunch ladies, to the substitutes, to our kids, to every single person, school safety is an everybody thing all the time.
And John, thank you so much for that presentation. It looks like we are a couple of minutes ahead. So Trish and Kent, we'll turn it over to you.
Okay, I'm not sure if Kent is on here yet. And I'm also, I sent Erica a message. I don't know if you have had a chance to look at it, but she has really good updates on, we have broke out to a subcommittee working on the suicide toolkit that is hosted on the KSDE website. And one of the reasons that this was brought to our attention was we have members here on this committee that have talked about, with the recent House bill, causing concerns with people asking questions to students, feeling like the wording on our guidance document is not very clear between if we're screening kids or we are giving an assessment to a kid. People are erring and not on the side of safety, in my opinion, because they're not asking kids questions because they feel like they have to give 4 months advance notice to parents. And we believe that that's a very big misinterpretation of that bill, because when we're asking kids in crisis a question, that's an intervention. It is not an assessment. And we do feel like updating this toolkit to give better guidance to the field is not only timely, but very necessary. So one of the things we've done is Kent and I have gotten a group together, and very qualified people who have lived experience with losing kids to suicide in their school. We have people from the suicide prevention headquarters working with us on this work. And we have broken the toolkit into a couple different sections that we've started to address. Speaking for my group, I'm on group 1. We have not even gotten through the whole first section. So I did want to go through and review some of the topics that we're talking about updating. And I do see that Kent just messaged that he's on here now. So Kent, feel free to unmute and jump in with me at any time. When we talk about the suicide prevention toolkit, one of the things that we want to do is we've talked to Dr. Watson, and he is going to rewrite his letter because we do have some different legislation. We have some updates, and we do have we want him to reiterate that it is still his concern, and it is the concern of the Department of Education to address this so that people feel supported and they know that they can do their jobs. They're trained professionals. That's why we have them in the school, and kids need to know that they have access. If you would like to share your screen, Gail, with the information from part 1. Okay, so if you go where you can see the blue highlighting, we had quoted in the guidance document at the beginning some regulations that were coming out of California. And from the people who did this guidance document, when they produced this, this was the most accurate and up-to-date information when they started doing this work in 2016. And so talking with some of them, they've given us blessing of making sure that this has to be as updated and accurate as we can for 2023. We're not going to rush this work, but we really do hope that we can get this data out and these updates to staff. We're going to highly encourage people to post what their school, this is a guidance document, and every school district needs to have a plan in place. We're going to highly encourage them to post their policy and their procedures on their school websites so that parents have access to this information immediately. So updating with the Jason Flat Act link on page 1 is one of the first things that we want to do. And if people post this on their websites, it won't be somebody has to type that in, but they can get the interactive link right off the website and go directly to it. And then on page 2, we talked about making sure the narrative is really clear that every school member is required to have 1 hour of training every school year. We know we have turnover. And so one of the questions we've talked about within our group is, so if we have a para who quits in October and we have a new person that comes on in November, we still need to make sure that new person that's working one-on-one with kids has that 1 hour training on suicide prevention. We've also talked about on page 3, we're going to add some kind of a timeline or flow chart of services. And we're encouraging people to look at the Can Train video that is available through Suicide Prevention Headquarters. Dr. Jane Groff also gave us a resource that we can include on page 4 from KPERC. And I just, if you have ever heard her talk, the information and the accuracy and the timeliness of the data that she has for parents, we want to make sure we include parents every step of this journey because we have their kiddos for 8 hours a day. They're out there at home or in their communities for 16 hours a day. We want parents to feel informed as well as the education staff at the school. So we're going to link in Jane's resources in this document as well. We are also going to, under the advisement of Scott Gordon, who's our general counsel here at KSDE, we're going to put wording in this document that makes it clear that if a student comes into you in crisis, asking questions to help determine if this is a kid that's at risk is a proactive and preventative measure. So if we are not asking, and this kid has presented to us, and a reasonable person could say that this kid appears to be a student at risk, if you don't ask those questions, you are liable when that kid walks outside the building. We want to empower teachers, social workers, psychs, counselors, the mental health people that we're partnering with through MHIT. We want everybody to feel empowered to get the right level of training available so that we're doing what is best. I was talking with somebody yesterday, and in the medical profession, we say do no harm. And in education, that should still be our philosophy as well. So we're wanting to make sure we put that empowerment language in the guidance document. On page 4, we're going to put links to the Can Train video, Telehealth Rocks, CanAware. These are all resources that districts can choose from as they're building their district level models. And then I think we talked about the timeline again on page 5, but we've already mentioned that. Let's see. On page 8, one of the wordings was talking about the risk levels based on an assessment. And we are not going to use the word assessment. We are going to use the common language that is with our partners at KDADS, DCF, KDHE, the people at Suicide Prevention Headquarters. When we're talking about assessing the risk for a kid, we're just doing a screening. Our job is to screen and then get that warm handoff once parents have been contacted, making sure that we do that successfully so that a trained professional in the mental health field can do the assessment and work with the family to decide what services and supports can be offered to the kid and to the family. So we're going to reword that to say, we're going to help determine if a student is at risk. Schools have the right to say, we really feel like this kid is showing a lot of risk behaviors. And so we want to make sure everybody's using common language so that when we do that warm handoff to the professionals in the community, we don't get lost in misusing language and just assuming everybody knows what we're saying. We're going to communicate very clearly. Let's see, if we go down, one of the things that we wanted to do was make sure that we have the terminology embedded throughout, because in the guidance document we have currently, it's on page 63. And we want to make sure that we use that terminology throughout the document and not just define it in the end, because not everybody that's in crisis that may find this on our website or open it up on their school district page is going to know to go to page 63. And we all know the research with websites. If a school posts this on their website and a parent in crisis gets down to page 4 or 5, they're not going all the way to the end of a document. They're not going to get there. When they're in crisis, they're just trying to help their kiddo and getting, scrolling past however many pages to figure out what this means. We're embedding the resources within the document so it's interactive and more user-friendly. Erica, I did see your message over here, and it says that anyone can do a suicide screening to detect the presence of potential risk. Only licensed mental health professionals can do the assessment. And we're not expecting or asking schools to do that. And that I love that you clarified that, because that is the language we want to make very clear to everybody in the field. A teacher, a coach, a janitor, anybody that thinks that a kid might be at risk can assess if a kid is at risk. However, we do not do the assessment. The assessment is by our certified and clinically trained professionals. We are also going to get the climate types report and get that data to schools so they can use that to make informed decision on building their local plans for how they're going to manage these situations. And then on page 12, we're going to update that information with current CDC data for the state of Kansas. We are also going to, when this document was developed, it was very taboo and people didn't really talk too much about the suicide rates in our LGBTQIA plus communities. And we really feel strongly we need to include that data because that's part of our Kansas data. It's part of our Kansas narrative. We cannot ignore numbers. When we have the information, we need to act and do something with it. So in the first document, there's a side paragraph on it and it does address it. But we feel like once we get all of our data put together, it's probably going to be a full page of information on how to provide support specifically for that community so they are feeling seen and heard when they're in a moment of crisis. We also talked about bringing up data from the Blue Ribbon Panel schools. And then we're also going to list supports that let the school social workers, school counselors, and school psychs know with their code of ethics links on there, they are doing what they have been hired to do in every district. I really feel like empowerment has been a very common thread in all of our meetings, making sure school staff that are placed there to help are actually feeling like they can do the work that they've been asked to do. We're going to include the links to the TASN School Mental Health Initiative team, which is our MHIT team, so that schools that may not be currently participating, if you have parents asking school boards, why are we not part of this, that might get the ball rolling where they can have resources at their fingertips. Where in our smaller districts, we know that they don't always have access. We do have schools still. My assistant is Gail, and she has done an amazing job going through every school's website and identifying where we don't have school counselors listed, we don't have psychs listed, we don't have social workers listed, because that is definitely an unmet need. Not every district funds that because they don't have the population, and in their world we need to make sure we get the supports to them and then identify on their school websites how parents can also access those supports. If you go to our very last page here, we have on page 12 warning signs, and then we have some things that we want to add to those lists of warning signs, like decrease in engagement and activities, excessive absences, decreased academic performance. Another thing that we've kind of talked about, but we haven't gone in depth on, is when everything has seemed really dark and all of a sudden they just seem like everything's okay. Sometimes that's an indicator that somebody has a plan they're getting ready to work out. So we're going to add that to the list as well. We want to make sure we're just empowering with information. The Herd Alliance and then the Columbia were two different tools that have been listed in the old document. We're going to continue to list those as resources. We're going to link the websites there. We're going to link the Families Together link in there so that families know. We want families to have more than enough resources and not feel like they don't have enough. So the CAN Train video is called A Suicide Screening and Assessment. And anybody that's on this call right now can get on and register. It's free. Get that training, get that common language, talk with your boards and see how they want to possibly use that, because we are trying to embed that within this new guidance document. Kent, I think I covered everything on our notes for section 1. Do you have any things you would like to add? And then Erica has volunteered to go over the part 2 modifications we're talking about.
You did a great job, Trish. Thanks so much. And thanks, council members, for sitting on these work groups. It does require time, and it certainly complicates our daily schedule, but I think you can see that the end product will make a significant difference. And I do want to say this, the original document that TASN put together was wonderful, but the landscape has changed since 2017 and 2018. And as Trish alluded to, a lot of our discussion was focused on how do we address House Bill 2567, Section 27, which is the student survey a section. And a lot of schools were very concerned about asking kids how they were doing, simply based on what they read in Section 27. So I think this clarifies it. And I appreciate the fact that our general counsel has stepped up and told us that it's the school's responsibility to make sure that those kids are safe. And so it's an issue of liability in regards to asking kids, screening kids. And I think this document also is going to help answer those questions that we had, screening versus assessment.
Gail, can you give Erica Moody permission to share her screen?
That would be great. Thank you.
Yep.
One thing I will say about the Kansas training that Trish mentioned, I put the link in the chat, but I think we might need to talk about doing one specifically for schools once we finish this toolkit, because in that training we are using the same tools that we're going to be using for the toolkit, but we are still using some language that schools are kind of afraid to use when it comes to like identifying risk or like designating a risk category. And so it's great information. It's still best practice. If you wanted to take a look at that training, you're welcome to. And we might need to talk about doing one specifically for schools so that the language is more consistent with the toolkit. So the section 2 that another group of us have been working on is specifically suicide intervention. Can you all see my screen? Okay. So this is the suicide intervention part. Sorry, I'll scroll up so that you can see it from the beginning, but we have not gone all the way through, and we haven't done this in a super linear fashion. So I'll show you kind of from the beginning what it looks like. But then I'll kind of dive into just quickly the screening tool that we're using and the way that we changed it so that we're not designating a risk category, but we're still using best practice. So this is just like the overarching steps that someone would take once they know that once it's been reported to someone on the suicide risk or crisis intervention team at the school that a student might be at risk for suicide. So we want to notify caregivers, and we have a whole protocol for how to do that and when to do that and what to do, you know, each step of the way. And then you complete the suicide risk screening, and then you talk about safety and you talk about follow-up. So I'll quickly show you some of the language that we came up with for talking about suicide screening versus suicide assessment. This is something that we're going to continue to tweak, but this feels pretty good to kind of address the concerns that Trish was mentioning. So this is just information about suicide screening. Schools should feel empowered to confidently conduct suicide risk screens. Schools are responsible for responding to suicide threats and warning signs of suicide risk, and the best way to do that is to start with screening. To be clear, suicide screeners are not clinical assessments, and they do not predict suicide attempts or deaths. The purpose of a suicide screener is to detect potential suicide risk and inform safety planning and intervention next steps. It is recommended that all school districts use a validated screening instrument, and that this validated instrument is used consistently throughout the district. Furthermore, the school should identify which specific staff members will be designated to facilitate these screenings, and those staff members should receive adequate training on the tool that is chosen. There are critical distinctions between screening and assessment of suicide risk. The primary difference is that anyone can conduct a suicide screening, whereas only qualified mental health professionals can conduct suicide risk assessments. Again, the purpose of a suicide screener is to detect the potential presence of suicide risk, and the purpose of a suicide assessment is to paint a rich clinical picture of a person's suicide risk. Suicide screeners are intended to be brief and straightforward, while suicide assessments are much more thorough and rely heavily on clinical judgment to inform next steps. Often the outcome of a suicide risk screening may indicate the need for further clinical assessment. And then we talk a little bit about the tool that we're recommending schools use, which is called the Columbia Suicide Severity Rating Scale. And we just talk about why. So this is the one that we're recommending. Schools can choose a different one if they'd like to, but this toolkit's going to focus on this particular tool because it is the gold standard of suicide screening for lots of reasons, and I just kind of go into explaining why. This is what the tool looks like. What we did was typically the Columbia is color coded to show level of risk. So it typically operates from a low, moderate, or high risk standpoint. So it's like yellow, orange, or red. We took the color code out of it, and we are not using that language around low risk, moderate risk, or high risk. We're just asking the questions and documenting how the students respond to those questions. One of the things that I did previously to this work was I combined the typical Columbia suicide severity rating scale for schools. I combined it with the one that the folks at whoever created the Columbia, they created one also for students for very young children or students or people who are cognitively impaired or may have a different cognitive ability. And so I just combined those to include in like all the language that a school district would need, so that no matter what age or cognitive ability the person is that you're screening, you have what you need on the same form. So that's why it's a little bit longer than normal. So there are 6 questions. You ask the 6 questions, and then I'm not going to go through those questions, but once you complete the screening, you consult this chart, which we are just calling the suicide screening response protocol. And it just, instead of saying no risk or low risk or moderate risk or high risk, we're just talking about how does the student answer the question. So if the student answers no to questions 1, 2, and 6, which are the 3 questions that you're always going to ask, then these are the steps that you take. If student answers blah, 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 these are the steps that you take. If the student answers blah, 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 these are the steps that you take, etc. So there are 4 different like ways that the Columbia could be answered, that the screener, like 4 different outcomes that the screener could have. And for each of those outcomes, we are going to give specific steps for recommendations for what steps should be taken. Again, this is a recommendation. It is not a requirement. So schools are always welcome to change whatever makes sense for them and use parts of this however they see fit. The other thing that we worked on, I'm almost done, I promise. The other thing that we worked on is the parent contact acknowledgement form, so that we are clearly communicating to parents that their child was screened and that we are communicating the outcome of that screener. The school is making specific recommendations for what should happen next, because the school has a responsibility to do that. The parents don't always have to agree to those recommendations. And in fact, they won't always agree to those recommendations, but we want to clearly document these are the recommendations the school is making, and these are the recommendations that the parent is agreeing to. And the school and the parent will sign this document. And one of the things that we really liked on here is that we're putting ownership on the parent, we're putting responsibility on the parent. I am responsible for taking actions necessary to ensure my child's continued safety. So that's this form that we've been working on. I think we've got it down I think we're pretty happy with it at this point. And we still have some work to do around some of the pieces that aren't as scary or big as the ones that we've worked out so far. There are definitely still some things left, but those are the main things that we were concerned about that we finished. I'm happy to answer any questions.
Hey, Erica, could you please shout out the other members that are on your team?
Yes, thank you. So I've been working really closely with Holly Yeager and Melanie Scott and Jessica Lane. And we are like a dream team. It's great because I am not a school professional. Never have I worked in a school. I am a suicide prevention person. And I have a lot of opinions, and they're like, reel it in, Erica, reel it in. So it's been really great to work with that team.
I have to say this, Erica, you're not the original dream team. Melanie
Fair.
Scott and some counselors that put together a great summer academy went by that moniker last year, and we're going to do it again. Something to look forward to. We'll get that information out to council members soon.
Okay, thank you so much for that. Now we're kind of running behind a little bit, and out of respect and appreciation for your time, we were scheduled for a 15 but a 15-minute break. But if we could be back by 10:50, 10:50, and we'll start up then. Okay. Happy break. Okay, by my clock, our break should be over. I hope you all are ready to resume our meeting. Thank you all. All right. Rachel from Community That Cares, we're ready to hear from you.
Excellent. Hi there.
Hi.
I'm going to pull up my slide deck and see if I'm able to share here. All right, confirming folks can see my screen. Here you'll have access to today's slide deck. I'll also put a link in the chat for you. If you click that, you'll get a copy of the content that we'll be looking at together today. Okay. Well, I'm Rachel Phillips, project manager for the KCTC team at Greenbush, and I'm here to talk with you about the 2023 Kansas Communities That Care Student Survey results. Today, we'll focus primarily on survey participation rates and what kids are saying about their mental health, along with a few surrounding factors correlated to adolescent feelings of depression and suicide behaviors. First, a little bit about the survey and its history. This survey is built on a framework for prevention, and it is funded by the Kansas Department for Aging and Disability Services to support effective evidence-based prevention strategies in Kansas communities. It's a voluntary survey available to schools at no cost and has been administered by Greenbush through hundreds of public and private school districts each year since 1995. It reaches thousands of middle and high school age students asking questions about topics like substance use, school climate, bullying, depression, suicide, and more. For many years, we've looked at how we intervene to help kids from being involved in risky behaviors, and we've looked at that in two ways. So there are risk factors that we can try to help mitigate, as well as protective factors that we can surround kids with. And the survey is designed around this idea. So today we'll look at what Kansas kids said this year. To get started, we'll look at survey participation rates this year. And to understand the context of this school year survey cycle, we must remember the timing of the changes to parent consent requirements that were put into effect during the 2022 legislative session. So the changes to active consent for guardians indicated three main shifts for surveys like the KCTC. The first of those being that schools need to provide parents with a copy of the survey, linking it directly to their school website, collecting consent separately from other surveys, in addition to collecting consent within 4 months of administering the survey. We also know that the number one way to increase participation rates in the KCTC student survey is to gather consent during school enrollments, which of course for many folks falls over the summer. So of these changes to the parental consent requirements in 2022, we found that the timing for implementation, especially for the 4-month window for gathering consent, proved to be the most challenging for many schools, where enrollments fell outside of that 4 months from when the survey was available for administration, typically November to January, and when folks are typically doing their school enrollments over the summer. And there was little time for adjustment to processes, especially for our bigger school systems. So for the coming school year, to help with this, we are trying to get the survey administration cycle in closer proximity to when most folks have their school enrollments. So this year we've expanded the survey window to October, allowing additional time for administration of the survey in 2024. So we hope this will help many schools meet that 4-month requirement for collection of consent. Let's take a look at survey participation specifically from this school year, the 2023 cycle. where we surveyed in 197 public and private school districts and validated over 30,000 surveys from kids, representing 20% of the eligible students in Kansas. So eligible meaning those kids in grade 6th, 8th, 10th, and 12th, where we survey. This is less than half of the participation rate that we saw the prior year, and it is the lowest participation rate that we have experienced in the history of the survey over the past nearly 3 decades. We know this is largely due to the timing of those changes that were implemented last year. And especially our larger school districts just said there wasn't enough time to kind of adjust those processes, many of whose school enrollments had already taken place. So this graphic, you'll see 28 years of participation graphed over time. So you can see the steady incline in participation over the years. And you can also see the last time surveys like the KCTC were impacted with participation when the Student Data Privacy Act shifted from passive consent to active consent for opt-in surveys. We saw a drop again as schools seek to align with the rules, but need time to shift. So we did see a steady incline again over that. We had kind of that pandemic year decrease. A lot of folks were remote. And then again, this year we had that big drop with the timing of that shift in regulations for active consent. So we know folks are resilient, and we do anticipate observing those participation rates steadily climb in the coming years. Now we will look at what students said this year. We do want to let you know the content in the coming slides does have some sensitive content, so just be aware of that. There are many behaviors measured on the survey, ranging from suicide behaviors to bullying and substance use. In 2023, the highest prevalence of adolescent behaviors reported were feelings of depression, bullying at school, along with cyberbullying, worrying that food would run out at home, and property stolen or damaged on purpose in those bullying items. Not in the top 5 necessarily, but closely following and slightly down from last year when it was in the top 5 are also reported thoughts of suicide. We're including those today since that's a specific area of focus for this group. Today, we'll spend time diving into each of these 6 most prevalent areas to take a deeper look and see some of the surrounding factors. Looking through a lens of prevalence, here's another way to look at those 6 most prevalent behaviors in the context of the prevalence of other behaviors measured on the survey. So of course, you'll see the mental health piece up here, right next to the bullying components at the top most prevalent levels, followed closely by food insecurity, safety, felt safety at school, gambling, and then substance use. Let's look at reported food insecurity briefly. As we know, studies have shown a connection between nutrition and your brain, more specifically between nutrition and the worsening symptoms of mood disorders such as depression, according to the Harvard Health Publishing Harvard Medical School. So we'll take a peek at this question that we began measuring through the KCTC in 2021. That was the first year that students were taking the survey remotely through the pandemic. And there has been a reported increase each year since we began asking this question in 2022 and of course again in 2023, where nearly a quarter of students report having worried that food would run out at home at least once. The graphic you see here is a map of Kansas showing county comparisons. You can kind of see those hot spots by students reporting this experience at higher rates there in the darkest blue. And on our website, you can go check this out. The map is interactive and you can toggle between counties and look a little closer. When we look at our KCTC food insecurity data by our 2022 SOGI pilot demographic data for gender identity and sexual orientation, we do find that LGBT plus students in Kansas report experiencing food insecurity twice as much as straight or cisgender students. The aggregation you see here is the time frame for at least once a month, which is more frequent than what we saw on the previous slide, which was an aggregate for at least once for all time. Now we'll look at what students are telling us about their experiences with feelings of depression and suicide behaviors. Thinking in the context of many trends measured on the survey, we see reported substance use trending down. This kind of mirrors what we're seeing nationally as well. However, students reporting depression and suicide are trending up overall. So looking through this lens of prevalence, about 3 times as many students reported feelings of depression than reported drinking alcohol in 2023, while students reported thoughts of suicide was double the percentage reported by students reporting having drank alcohol. This is a little closer look at the reported depression and suicide behaviors over time, where we can see that all behaviors are currently reported at rates above their initial levels when we first began asking about this in 2016. During the past year, in 2023, these are the percentages of students reporting feelings of depression, serious thoughts of killing themselves, having made a plan to kill themselves, and reporting having made an attempt or tried to kill themselves. When we look at the totals of students surveyed and aggregate their responses to be inclusive of the past month and the past year, we find that 18% having reported these thoughts of suicide and 12% reporting having made a plan are both about 1 percentage point decrease from the prior year. While around 5% of kids continue to report having tried to kill themselves in the past year. This is down approximately 0.5 percentage point from the prior year. Reported feelings of depression have steadily been increasing over time since we first started asking about them again in 2016. And there was a marked increase during that pandemic timeframe in 2021, where annually there was a rate of increase of about 2.5 percentage points. And during that 2021 year, there was a 5 percentage point increase. In 2022, it increased again slightly, about 0.5 percentage point. And then for the first time this year, we have seen a decrease in reported feelings of depression. So while that is something to celebrate, this is still something we want to keep an eye on, as it's not a decrease overall, but it is a 1-year decrease, again, for the first time ever, something to be thankful for here. It does seem that the rate of increase is kind of leveled back out to what we were seeing in those pre-pandemic years, where that rate of change was about 2.5 percentage points annually. And this year, that change comparison from the pre-pandemic survey in 2020 to now was around 2 percentage points. This is a look at what kids said in 2023 about having serious thoughts of killing themselves. Nearly 9% of kids reported having had these thoughts within the past month. Let's look at that a little deeper, these thoughts of suicide over time. So here's a measure from 2019 to 2023, looking at the time frame within which kids reported having these feelings. Unfortunately, recent thoughts of suicide or in the past month are at an all-time high, with the exception of the percentage reported last year, shifting from 6.5% reported in 2016 when we first started asking to more than 8.5% reported this year. Thoughts of suicide in the past year is lower than they have been in the past 6 years, which is good, definitely something to celebrate there, although it is still above where it was when we first started asking in 2016. So it has shifted a little bit from 14% in 2016 to nearly 18% this year. And then thoughts in that time frame longer ago, so from 1 year ago or more, has also shifted, where students are reporting having had these thoughts increasingly, right? It's on the rise. So from 2016, where it was at about 9%, to this year, where it's at nearly 13%. When we aggregate for all students reporting having had serious thoughts of suicide in their lifetime, this translates to nearly 1 in 3 Kansas kids surveyed reporting having seriously thought about killing themselves. A correlational analysis of KCTC results was conducted utilizing data derived from the depression and suicide prevalence measures and risk factor indicators measured by the survey. So we'll highlight a few of those results and key findings for you today. Looking at the past 3-year trend, where data was included from 2020 to 2022, a few consistent patterns in a few demographic groups were found. Analysis over a 3-year period indicated patterns within these 3 demographic groups. Consistently across the past 3 years, larger percentages of students in these 3 groups, female, Latino, and military families, showed larger percentages of reported past 30-day substance use for alcohol, vaping, marijuana, and prescription drug misuse. Also for feelings of depression and suicidal ideation and behaviors. When we look at our KCTC suicide data by our 2022 pilot data for sexual orientation and gender identity demographics, we find that transgender and non-binary students in Kansas are 4 times more likely to report experiencing suicidal ideation and behaviors. Here we see the breakdown of reported thoughts of depression and suicide behaviors by birth sex in a binary form. And we know that females report thoughts of depression and suicide behaviors at rates much higher than males. And while we see the majority of students reporting suicide attempts are female, we also recognize that this is nearly the flip of what we see in the Kansas Department for Health and Environment violent death reporting system, where suicide data show that 72% of actual deaths by suicide occur in males. In this presentation, we don't explore the reasoning in depth, but we do know that one reason for this shift in reporting versus lethal experiences is that males report choosing more lethal means when attempting suicide, according to the State of Kansas Suicide Prevention Report from KDHE. Reducing access to lethal means for suicide has been shown to save lives from suicide. This year, more than 1/3 of kids who reported they had made a plan to kill themselves also said it would be easy to get a gun. According to the Kansas Suicide Prevention Plan and KDHE's violent death and reporting system, firearms were utilized in the majority of suicide deaths from 2015 to 2017. And data shows that this method is most commonly chosen by males. The percentage of students who report alcohol use is much larger for students who also report depression and suicide symptoms. Alcohol use also increases with severity of suicidal behaviors from depression through suicidal thoughts, plans, and attempts. This year, kids who reported having made a plan to kill themselves reported 3 times higher percentages of alcohol use. According to the Kansas Suicide Prevention Plan and KDHE's violent death reporting system, toxicology reports show that alcohol is a factor in 35% of suicides. Early initiation of substance use is also associated with reported depression and suicide thoughts, plans, and attempts. And the KCTC data show a strong link between depression and suicide symptoms and substance use as well. The average age of Kansas kids reporting their first use of alcohol is age 13. Interestingly, the most frequently reported age of Kansas kids telling us that they have tried to kill themselves in the past year is also age 13, followed closely by students ages 15 and 14. So this is an aggregate from the past year, and this is a frequency count by age. And here you see the percentage of students, where we know students in this age range typically are in 8th grade, closely followed by those surveyed in 10th grade. And again, 8th grade, this is where we see the largest percentage of students reporting having tried to kill themselves, both in the past year as well as in the past month. So observe how this gap increases for that more recent experience. So the rate here for 8th grade students reporting having had this experience in the past month is at around 2% of 8th graders, and in the past year at around 6% of Kansas 8th graders. The most significant protective factors associated with low reported depression and suicide include students feeling close to an adult they live with and feeling safe at school. So here on this slide, we see that students feeling close to the adults they live with is associated with lower reported depression, 75%, in comparison to their peers who do not report depression and also do not feel close to the adults they live with at 91%. So this is also true for suicide thoughts, plans, and attempts. We see similar connections. On the flip side, we know that students that do not feel close to the adults they live with experience higher reported rates of depression. So at 25% here in comparison to their peers who do not report feelings of depression and do not feel close to the adults they live with. Similarly, students report lower rates of depression when parents notice they are doing a good job in telling them about it, as well as when teachers and neighbors notice. So we know healthy, engaging relationships with caring adults matter. As mentioned before, one of the most significant protective factors associated with low reported depression and suicide includes students feeling safe at school. This year, we continue to see that students feeling safe at school is associated with lower reported rates of depression at 77% in comparison to their peers who do not report depression and feel safe at school. So this is also true for suicide thoughts, plans, and attempts when you look at those connections. Again, on the flip side, students that do not feel safe at school are also associated with higher levels of reported depression in comparison to their peers who do not report feelings of depression and do not feel safe at school. Similarly, students that have not missed school because they felt unsafe at school are also associated with lower rates of reported depression compared to their peers who do not report depression and did not miss school because they felt unsafe. Again, on the flip side, another way to think about this, students that missed school because they did not feel safe at school report higher rates of depression in comparison to their peers who do not report depression. When we look at our KCTC felt safety data for our 2022 SOGI pilot demographics, we find that LGBT plus students in Kansas report feeling unsafe at school at much higher rates than their straight and cisgender peers. So for example, here we see 43% of transgender and non-binary students reporting feeling unsafe at school in comparison to just 16% of cisgender kids. With these connections between school safety and mental health in mind, we want to next explore bullying at school experiences reported by students this year. This year, we know that 32% of kids reported experiencing bullying at school, while 28% reported experiencing cyberbullying, and 19% reported having had their property stolen or damaged on purpose. Each of these are at a reported increase, rates increasing in comparison to the prior year. In March of 2019, Commissioner Watson chartered the Blue Ribbon Task Force on Bullying based on the percentage of students reporting they had experienced bullying. The percentage of students who reported having properties stolen or damaged on purpose had been trending downward over time, with a significant dip during that pandemic year when more than a third of kids were attending school remotely, as reported on the survey. But then that has continued to climb back up as kids returned to the classroom in the prior year and again this year. Similarly, we see cyberbullying kind of at a standstill here historically, and yet there was a significant increase during that pandemic year, where again, a large portion of students were attending school remotely. And during that time, it surpassed reported bullying at school for the first time in the history of this question being asked on the survey. However, when kids returned to the classroom, we did not see reported cyberbullying decrease, and we did see bullying at school jump back up. So at this time, kids are continuing to report experiencing both bullying at school and cyberbullying at elevated levels, which are also at an all-time high for the past 6 years. In 2023, our data continues to show that nearly 1 in 3 students surveyed reported being bullied in the past year. Here we see the frequency with which students reported being bullied at school this past year, with 4% of students reporting having had this experience every day. These students who are bullied more frequently also report higher levels of and prevalence of other risky behaviors measured on the survey, such as depression. So remember earlier we were talking about 8th grade kids and those students around age 13 reporting suicide plans with a higher frequency. This is a look at students in middle school, and we see that frequency is elevated in comparison to students reporting these experiences at the high school level, with that everyday experience being reported at more than twice the percentage as reported in high school. And similarly, students reporting being bullied 1 or 2 times a week or regularly, nearly twice as often as students reporting that at the high school level. Here's what we know. Kids who report being bullied daily report feelings of depression twice as much as kids who report having never been bullied. And being bullied regularly or once or twice a week also shows higher reported levels of depression. When we look at our KCTC bullying data by our 2022 SOGI pilot demographics, we find that transgender and non-binary students in Kansas report being bullied at school double the percent reported by cisgender students. Let's peek at what Kansas kids said they do when they see bullying. Thankfully, the majority report helpful upstander behavior, doing something to intervene or stop the bullying. And this year, we continue to see a larger percentage of middle school students reporting helpful upstander behavior when they see bullying. This is reported at higher levels than at the high school level. Now we'll look at what kids perceive adults do when they see bullying. And it's good to know that most students also report observing helpful upstander behavior from adults, doing something to intervene or stop the problem. However, again, we see this helpful behavior reported at higher levels at the middle school than we see at the high school level. And in high school, more students report either bystander or being unsure what adults do than report this helpful upstander behavior. So knowing what we know about the positive impact of caring adults, teachers, and school safety, and what those impacts have on kids and their mental health, we believe that the upstander behavior data is important to take into consideration in the context of considering mental health for kids. Depression and suicide continue to be important topics. I think Kansas kids are underscoring the fact that this relevance continues to be helpful for kids to be able to learn in healthy ways and manage their thoughts and feelings. And it's important that kids know how to do that in healthy ways and where to go for help. that is the end of the content that I have for you today. I know that we're on a tight time schedule, so I'm sorry it was a little at hyper speed, but I do want to provide plenty of time to answer your questions and maybe revisit some of that content if there are some specific questions.
Rachel, thank you so much for that. I have so many notes that I made during your presentation. The one thing that you honed in was an area where we still can talk about the unmet needs, which is bullying. You showed such a great correlation in many of the factors. And I am hoping as members that we look at recommendations that we can make, because obviously, even though bullying has been on, has just been on our minds for so long, obviously there's still a lot of work that we need to do in that area. So I really appreciate your presentation and the information that you provided. Now, she's open for questions, so I am going to go ahead and pause. If you have a question of Rachel, please go ahead and jump in.
I have a question, and this may not have been within the scope of what you wanted to present, so if not, that's fine. But I'm curious because of the lower response rates, if you had a chance to compare the data this year on suicide to other metrics that measure youth suicide, both in ideation and attempts, and how similar or different those numbers might be.
Mm-hmm. Yes, we do make annual comparisons with national level surveys, such as the YRBS conducted by the CDC. And Kansas KCTC results continue to align with kind of the patterns that we also see at that national level in those surveys. Is that kind of what you were thinking?
Yeah, so my question was, in the same way it has in previous years with higher response rates, you didn't see the response rate didn't change the alignment in any way?
Our team of analysts conducted so we conduct validity and reliability checks annually, and our team conducted special additional checks this year to verify the validity before we made the choice to publish the results, since there was such a decrease. So we did find that it was still representative of the state of Kansas and the students surveyed. Mm-hmm.
I think that's a really great question, because we had a small response rate doesn't mean the people that responded didn't give valid or reliable data. But I do think that we need to make sure we communicate that clearly on all the slides, that this is of the people that responded. And I see that mentioned on several slides, because we want to make sure we're getting accurate and clear information out there. This is great data to give us where we need to start and the reasons that we need to go to the board with these unmet needs.
I also am wondering, and of course the heavy lift is on family engagement, but I'm wondering how many parents might be aware and taking advantage of the opportunity to reinforce the closeness with their students, knowing that this will help them in terms of being in a positive place. I don't know if I've ever been aware of that being encouraged, that one of the ways that you can help your children is to reinforce that closeness at home, which would carry forth. Again, I don't know how we can present this, but it certainly brought thoughts to my mind that maybe I can do a better job of creating a more positive relationship, so that when you go out there, you know you have that closeness to an adult. Is there a way that we actually encourage it, that kind of closeness? And that's put out
Betty?
to anybody. Yes.
Yeah, Betty, this is Jane Groff, and I thought the same thing years ago. Like, I think it was 2 or 3 years ago. It really hit me. So Caper did presentations in school districts, really encouraging them to share, especially those family pieces of data, like maybe even at back to school night, because if parents have opted in, have their children take the survey, then they should and could hear about the results of that survey. So those would be great things to share, in my opinion, on the back to school night. Remember you had your child take the survey. These are some of the things that we've learned about your engagement as parents with your children and some of the results. So again, I think that schools could use pieces of this data in really valuable ways. And so KPERC did workshops on that, Betty, around the state to encourage schools to use that data. Parents should know, if their kids took that data, some of the results.
Jane, it would be really interesting to partner with the local media. Do you remember the 5 o'clock announcements that they used to make? It's 5 o'clock. Do you know where your kids are? And just say, hey, every kid needs connection. Do you know who your kids are connecting to? They're going to find somebody to connect to. Who are they connecting with? Because most parents want it to be them. So that would be an interesting thing to explore.
Right.
And to add on to that, go ahead, Jane.
No, just that it's positive data for the most part. It's positive in that when they're close to you, mom and dad, they have less of this feeling and less of that feeling, or less of this attempt. So, it can be an encouraging, motivating piece of data for families.
And the other piece of that is how many parents think their kids feel close to them, when in actuality, that might not be the case. We like to feel that our children are comfortable sharing, but how do we validate that feeling is there? To just emphasize that a little more, I think, is a great step as well.
Good point.
We have a couple of more minutes. Anybody else have a question or of Rachel, or a comment that you would like to make?
I really appreciate the heart and passion behind folks' discussion and connecting families with their kiddos, and helping parents be aware of this meaningful connection and just how positively that impact works with our kiddos. I did want to share a resource that we've got available on our website that we encourage folks to share. And if folks follow us on Facebook, we have similar content that folks can easily repost in their local communities. But check out the infographics. I've got some links in the chat, but here's one example that might kind of speak directly to that positive impact caring relationships have between parents and kids, teachers and kids, and even your neighbors in your community, where we see when parents notice, depression rates decrease. So just in case some of those tools, if you find them helpful. Some of these are one-pagers and easier to read than like 30 slide deck or a report that's full of a lot of content. These are a little easier for folks, and they all have helpful links to where folks can go to learn more about how they can do that thing to increase that positive relationship.
Well, Rachel, again, thank you so much. I know that we're going to have to rely on you for futures when we start looking at those triggers and identifying unmet needs that are so important to the health and welfare of our students. So with that, we thank you. And we are now ready to get an agency update from Bert. Bert, are you there?
I'm here, Betty. Can you hear me?
Yes, I can.
Good, because I've been having trouble with my audio, so this is good. The KCTC, we use that at my previous district. I shared that information with my board. I shared it with my administration and with teachers. The trend data doesn't look that good to me. It's symptomatic of what's going on in our society, I feel. And oftentimes, I know we talk about the parent connection, but having been a counselor, one of the things that I saw was a disconnect in those teenage years with parents, and parents not knowing how to deal with the child who seemed to be going through a lot of wanting to keep things private and secret, and then how to deal with that as parents. And so they try to do their best, but then if you've got a good counseling relationship with students, they will open up and share with you, and you can have some breakthroughs with them and make that connection in a positive way. I mean, I had a revolving door every day of students coming in and out, and oftentimes it was the conflict with the parent, which was generating a lot of the depression and the concern. So that's an issue I think that schools are going to have to address. And I know that we don't have enough mental health providers within our schools, but that's certainly something that I've tried to promote and that I'd like to see more of, that students have access to a caring adult who they can make a connection with. But back to the agency updates, a couple of things have happened so far. If you've been paying attention to anything going on across the street at the legislature, one of those things was the change from emotional disturbance to emotional disability. I know our Special Ed Advisory Council was promoting that language several years ago, and we had a legislator that brought it up, and it did get passed. So when you think of emotional disturbance, it makes it sound personal. But when you think of an emotional disability, it sounds like a condition that someone's experiencing. So it is a better approach, I feel, to identifying that disability for our students that are being served under ED. So I wanted to share that with you. The other thing that we have now is we really don't have anything that we can share with you on this, but we had legislators that enacted dyslexia as a state special education identifier. So that's something that we're all going to have to be dealing with here at the agency, as far as how we look at that as a state special ed disability when dyslexia is already covered under learning disability. In fact, the definition in the dyslexia handbook says that dyslexia is a learning disability. So it's going to be interesting how we deal with that here in the agency. We are working on our state performance plan annual performance report clarifications that will be submitted today. We had several items that we have had to clarify. We feel pretty good about the progress that we've made on that. Many states received clarification on significant disproportionality. And so we have addressed that, and we feel very confident that our message will get through. One of the things we've also done is we've sent out levels of determination, which has to do with the requirements that the state has for school districts. We have some districts that are identified as needing technical assistance. We'll be providing that within the next few weeks, at least offering it, opening the door, and then assisting these districts to look at policies, practices, and procedures, and then how they may want to address that. So from my perspective, those are the things that are currently on my plate that I'm working on here at the agency. I know that Carrie and Trish may want to share some things that they've been working on in the area of mental health. So I don't know, Trish, if you would like to jump in and share some of the things you've been working on.
Well, I have been working on interagency partnerships. And so working with Erica at the Kansas Suicide Prevention Headquarters, and then working with Gary. And then I've got some partnerships with DCF. There's a lot of really great work that's going on with trying to bring telehealth and mental health services through computer technology to all schools, and they have a legislation that they're working on proposing for the next cycle. So I think that's going to be very interesting work to see how we can get access to everyone and make sure that if a school just has a laptop, a quiet room, where there would be no HIPAA violations, that we can have those options for kids so we don't face excessive absenteeism. I think that there's a lot of really good work going on there. I think that one of the things I'm most excited about is partnering with the Attorney General's office and ComCare, and we have really worked hard to hopefully bring a movie screening to our support staff, our school social workers, our psychologists, our counselors in the area of human trafficking. The Attorney General's office is very concerned with the amount of trafficking that's going on, whether it's sex trafficking or work trafficking. And they want to make sure that we can recognize what we're looking at when kids are sitting in our schools and being able to identify some signals and signs where kids might be asking for help, or they might be needing levels of support that we can offer within the school. So those are two of the big things that I have been working on, as well as the suicide toolkit, but we've already talked about that.
Thank you, Trish. Carrie, did you have anything you'd like to share?
I have been working on some of the grant management side of the state personnel development grant that supports the school mental health professional development and coaching and evaluation. So the federal reports that are due for that in a few days. And then also the school mental health initiative team that does that work will be presenting, I believe, at the July meeting on a summary of their work and where they're at with all of that. Correct? Right, Trish? Right. Thank you.
Thank you, Carrie. The only other thing, Betty, I would like to visit about is, has anyone brought up the July leadership? Because we will offer school mental health advisory council meeting the last day of our July leadership. We'll be sending information out on that, but it will be an opportunity for this group to get together and meet in the afternoon for approximately 3 hours. I believe that Jane has an agenda already prepared for that. She has at least a list of presenters that she would like to recommend, and I know she'll work with you, Betty, on that. But I did want for this council to be aware that that will occur. I'm looking at my calendar. Carrie, do you have that real quick, the date for that? I think it's like, I've got it in my 23-24 folder.
July
Kayla.
27th.
Yeah,
27th.
Kayla just posted the link to register for that through Tazen in the chat.
Thank you. Because that, to me, I didn't see that on the agenda, and I thought, I think this is our last meeting, and this is an opportunity for us to invite you all to attend. This would be the registration link, and it's an opportunity for this group to kick the year off. We will have leadership meetings with the local consolidated plan, ESCA programs, which is Elementary Secondary Education Act, also called title programs. And then in concert with those opportunities, we'll also have special education updates for our special ed leadership and administrators. But we will culminate the activity, our July leadership, with council meetings the last day, which is the 27th. So there it is. You can take that and we'll send it out. You'll get more information. But Betty, I thought we ought to cover that today so that everybody was aware of that, could get it on their calendar if they have the opportunity, we certainly want them to have the ability to attend that meeting. And that's all we have.
And then I would just like to point out that for those that you might be new, your registration fee will be covered by your being a member of the council to come to that conference,
Thank you, Carrie.
the
Good
leadership
point.
conference. And then Bert, would you like to talk about the keynote speaker so that people are aware of Horatio, right?
I don't know much about
Sanchez?
Horatio Sanchez. Maybe you could talk about it, Carrie.
So he spoke at the Elementary Secondary Education National Conference and does a great presentation and on how to, for those of us, for folks that may not be as familiar with the brain science, about how to understand it in relationship to everyday life living and its impact on not just us, yourself as an adult, but with the main focus being on kids and learners in schools, and that, telling that story. He does an excellent job.
Thank
if anyone
you,
else
Carrie.
has heard him, they might probably have a better description.
Well, I think if you were to Google his name, you would probably get a lot of information, maybe some YouTubes that he's done. We'll type that in the chat, Kayla, if you could, Horatio Perez.
While Kayla's doing that, I thought of something I didn't update you on.
Okay.
One of the things that, if you know me, my passion is for justice involved youth and the mental health for students who are facing incarceration. And I'm working with a group in Wichita that I am just so impressed with. It's a community engagement group, and they had asked me to come to a meeting because they're working on what they call an IJP. And it's a document that they found through the Office of Disability Rights, which came from the Office of Civil Rights. And basically, when they had the young man named Cedric in Wichita who died in the JDC, they decided they've got to fix this and decide what we can do better. And so they are developing what is called an individualized justice plan. And it is a proactive measure that allows students who have intellectual developmental disabilities or mental health concerns to have a plan where if something is not going right, instead of cops automatically being the first person called, their community wraparound team, their community mental health contacts, maybe somebody that they have that close relationship with at the school is on their crisis team, and they reach out to those individuals first. And if it's a substance abuse issue, they may channel that to a substance abuse treatment instead of taking them into custody and criminalizing their mental health. So they're working really hard on developing that. Of course, there's a lot of logistics to figure out, like who writes it, where's it housed, how do you communicate it widely? But I really think that Wichita could be the trailblazers in this work for the whole state. So I think that's exciting work, and it's very proactive work for mental health.
And now I think, Betty, we're finished.
There's always more, and it's always something that's positive. So all right, now we're going to look at the future agenda topics, any suggestions that anyone might have. And I would encourage you, even after the meeting, if you think of something to please let us know, because sometimes it takes a little bit of time to work through and get that as an agenda item, as you well know. So it's open. Any kind of suggestions anyone wants to make right now?
So I will just point out that at the July meeting, Cherie and Amy and Laura and Stephanie will be presenting with folks from one of their district community leadership team. I think that is their plan. And they plan on presenting for about an hour. So that'll be a wonderful presentation. And we haven't had an update on all of that work in a while.
Hi, this is John McKinney. I have a quick recommendation. In the past, we've had, whether it be Kent or we've had some guests join us and provide legislative updates on specifically legislation that affects, our mental health of our students and staff. And there's quite a bit out there right now. I know that they're in the final stages of their session, but might be helpful when we do reconvene to go over bills that have passed, bills that are pending, just maybe an update on the various legislation specifically as it applies to mental health of our young people and adults as well.
Thank you, John, for that. And it does emphasize that one of the things in our purpose is to coordinate with our legislators prior to. So it's always good to get an update on where they are and maybe what we can do to influence things that will be in the favor of our students, our kiddos.
One of the
Anything else?
things that KCK is very interested in, and it goes along with what Kathy Ko put in the chat, is policies and procedures related to resilience building and trauma informed, specifically around like the code of conduct. How do we create more resiliency building code of conducts that are less punitive, more restorative, more relationship based? And so that would be something that I think would directly affect, because mental health is oftentimes a part of our discipline procedures and practices and lead to those office discipline referrals.
This is Monica Murnian. I'd like to suggest that we maybe hear a quick update from the Can Aware grant out of KU Med that's serving several school districts down here in Southeast Kansas, and how the use of community health workers within school districts is helping bridge the gap between access to behavioral health and healthcare. We have a large federally qualified health center down here that provides behavioral health services in our schools. And they have added community health workers, and it's a nice thing going on that others might want to hear about.
I would also be curious around more of community violence prevention. I'd be curious to hear more about substance use prevention specifically, not just the data around it, but more about what communities are doing for substance in general, not just the vaping or the fentanyl, but overall. And I'd also be curious to hear about how people are navigating, especially districts along state lines where marijuana is legal, how they're navigating that and what policies and procedures they're putting into place regarding that as well.
Also, one of the things that stands out, student violence in school has been on the rise, not just in our urban schools, but that's something that's going on in smaller districts as well. I don't know if we can look at what's triggering that kind of behavior, student on student violence, but it certainly warrants our looking into as well. Anything else? Well, it's not like we don't have a vast amount of suggestions right now. I also am hoping we'll have an opportunity for breakout session in, oh, maybe after our July meeting to start looking at some of the unmet needs and how we can start to prepare a presentation to be made to the state board on what those areas are. So anything else, I will let you know that we certainly miss Jane, but she managed to stay with us on her drive and drive safely. We have about 10 minutes left. If there's nothing else, I'm going to pause here, see if there is. Oh, big shout out to Gail and Kayla. They certainly spent a lot of time helping me, bringing me up to par on the committee and things that you've done. So it's always great to appreciate those that help us along the way. So I want to thank them publicly for working with me on that. Anything else? All right, well, if there's nothing further, I will adjourn this meeting, and we are looking forward to seeing as many of you as possible in July. Thank you so much.
Thanks, everyone.
Thank you.
Thank you.